We had an interesting case this week that we wanted to share with our runners.
A young man came in with left lateral knee pain after trying to increase some of his miles. And so we want to show you what we did for treatment and then show you what you can do to avoid some of this at home.
Hi everyone, I'm Dr. Mick Pinkney and this is Dr. Ryan Evenhouse. Our runner is a mid-20s male with left lateral knee pain who had been increasing mileage for about a 4-week period of time. 3 weeks ago, he started experiencing significant left lateral knee pain after running for a mile. That pain would result in a snapping and popping of the left lateral knee. Going up and down the stairs became very painful, causing a limp, and the pain would not resolve for 1 to 2 days following running. After we took a history and got on the same page, we went through a very focused physical examination.
So in the physical examination, we checked his range of motion, which was good, and then we also checked neurologically, everything was fine. And then we did orthopedic testing, checking for the muscles, ligaments, tendons, if there's any issues there. There was no meniscal involvement, which is pretty common in runners, which is good. The ligaments surrounding the knee, specifically the ACL and the PCL, which kind of prevent movement of the tibia on the femur. That was all perfect. The only finding that this patient had was he had tenderness whenever we pressed on the peroneal muscles, which are just a couple of muscles on the outside of the leg that kind of start from just below the knee and go all the way down to the foot. Because there really wasn't too many orthopedic findings, we then did some functional testing. So we got him on a treadmill and we had him run for a mile when it would about reproduce his pain, and then we video recorded him during his run. And so we're going to show you a little bit of what that video recording looks like.
On this video, there are two main things that we wanted to point out. First, as he's running, notice that as the heel is coming back up towards the buttock, that's known as the swing phase, notice how the heels flare out to the side rather than coming straight back. This then causes his foot to land already turned in and inverted, and that puts a tremendous amount of strain on that lateral knee and that peroneal insertion point.
And the second thing that we want to look at is he shows a little bit of a crossover gait, which typically means that when you're running, your feet shouldn't really be coming across the body to land. It typically shows glute med weakness, as well as some poor abdominal activation when they're running. So typically on the stance phase, you would need strong gluteal complexes to be holding you in, as well as the swing phase leg, the leg coming forward, is going to be kind of controlled by the abdomen and your abs and your core. So when you bring your foot forward and it's coming across the body, you almost sometimes get a swing in your hips, and you also get your feet come across midline when you're running. His isn't very exaggerated, but something that we addressed with him anyway.
So now we've identified a couple of main areas that are causing this particular runner to have pain. So what do we do? How do we treat it? So for treatment, first we'll discuss about what we did in the office, and then Dr. Ryan is going to go over some things that you can work on at home. So first, we wanted to address any biomechanical issues that were affecting this person's running. As a chiropractor, we want to adjust any tightness in the spine, in the SI joints, and in the ankles. And particularly for this person, we did adjust the thoracic lumbar junction and the sacroiliac joint. Those are both tight in runners because the muscle group that brings the knee up to the chest, that iliopsoas muscle group, will be pulling on those areas all of the time. Second, if you remember how our runner has the inverted gait, that where his ankle was already dorsiflexed, that shows that there's a tremendous amount of force going through that subtalar and talar joints as well. So we need to get those to move like they're supposed to, so when he's landing, he'll land as soft as possible. Additionally, in the office, we use mechanical assisted soft tissue techniques, mostly over the lateral peronei area and the lateral hamstring. This helps to break up some of the scar tissue that's causing that ropey muscle to always be tight and to change the biomechanics, not allowing you to run like you did previous to this injury.
Apart from those modalities, we also did rehab in the office because research shows that by adjusting and getting the joints to move with exercise gives people the best outcomes. And so with this rehab, you guys can also do this at home. The first thing that we did was we had them just walk on the treadmill, and we would have them work on bracing their core as they're walking, because this pattern will help them as they're running later on. And so how you can brace when you're walking is imagine yourself walking on ice, and you're being very, very careful, and you're walking as quietly as possible. That way, you naturally already engage the core and engage the hips to make sure that there's dampening on those steps. And then also in the office, we did some step ups, which is where we had him step up onto a box. That's just a natural glute strengthener. We did some banded walks as well. So we had him have a band, we put it around his ankles, and then we had him just do side steps. And then both directions, usually walking around 10 to 15 meters. And then we would have him do a monster walk, which would be, instead of doing the lateral side steps, it would just have a sagittal involvement as well to mimic running. So those are all exercises that you can do at home.
While you can never eliminate all injuries in your workouts, using some of these small coordinated movement exercises that were demonstrated earlier can definitely significantly reduce the types of injuries that you experience during your training. As always, use common sense and start slow and build up.
So we hope you enjoyed this video and found something valuable for your training and used some of these exercises to avoid some of these pitfalls that some runners have. If you know someone that is a runner and could use some of these tips, feel free to share this video with them, and like and subscribe if you're interested in more content like this.
For complete rehabilitation, I'm Dr. Mick Pinkney.
And I'm Dr. Ryan Evenhouse.